After a tumultuous 3 years of lockdowns and restrictions, the major parties are promising big spending on the health system this election. Before we get into those details, let's take a look at where it all went wrong. The pandemic created unprecedented demand for care, pushing other medical emergencies to the outskirts. This July, Alfred Health announced the deferral of elective procedures to continue prioritising urgent care. Years' worth of delays mean staff are still working to clear elective surgery backlog. Calls to emergency services skyrocketed, with an exhausted system struggling to keep up. Fewer than 70% of 000 calls were answered within 5 seconds during parts of the pandemic. The longest wait time was 76 minutes in January of this year. And at hospitals, paramedics were forced to oversee patients until they could offload them into emergency departments, decreasing their response rate. Officially, the recommended response time to Code 1 incidents is 15 minutes. But Ambulance Victoria says the ability to respond within that time dropped by 12%, from 79% in October through December 2020 to 66% in that same time period for 2021. Staff shortages were also seen in the Victorian emergency departments. Nurses were recruited for roles that previously didn't exist. Border closures disrupted the supply of international workers, and staff were forced to work overtime, many contracting COVID themselves. Overworked and understaffed, two key words here. Health funding is shaping up to be a major decider this election, with each party committing between $4 and $6 billion to improve the current situation. Major spending on hospitals has been a priority for Labor and the Coalition, with promises for new and upgraded facilities in metropolitan Melbourne and regional Victoria. This has been criticised for not addressing the problems of pay and working conditions for healthcare workers. Building promises aside, the Labor Party will create 25 specialised paramedic positions under a $20 million plan. Free nursing degrees will also be up for grabs. The Liberal Party are promising to shelve the suburban rail project and investing those funds in health across the board. PSOs will be stationed at 5 Melbourne hospitals in a bid to boost security. The Greens are entering the spending competition by committing $5 billion for healthcare. This covers plans for public dental care, more bulk billing GPs to the postcodes that need them most, and higher wages for public healthcare workers. We could see 500 new psychologists and psychiatrists for schools.